Sometimes people ask if it's possible to get too much sleep. The answer is yes, absolutely. Certain types of mood disorders, particularly if you're dealing with depressive symptoms, can be characterized by excessive sleeping. If you are concerned that you're sleeping too much, pause and consider the following. Are you sleeping more than you usually do? Are you sleeping to avoid certain activities? Are you sleeping to avoid how you're feeling? Sadness? For healthy people, getting too much sleep on occasion is more likely to indicate that you are experiencing sleep deprivation. Oversleeping because you are sleep deprived can also disrupt your sleep cycle. Next, let's discuss over-the-counter sleep aids, or OTC sleep aids. People also ask about using over-the-counter sleep aids, such as melatonin. Over-the-counter sleep aids can be effective for an occasional sleepless night. There are a few caveats, however. Most over-the-counter sleep aids contain antihistamines. Tolerance to the sedative effects of antihistamines can develop quickly, so the longer you take them, the less likely they are to make you sleepy. In addition, some over-the-counter sleep aids can leave you feeling groggy and unwell the next day. This is the so-called hangover effect of sleep medication. Medication interactions are possible as well, and much remains unknown about the safety and effectiveness of over-the-counter sleep aids. Keep in mind that you should never use an over-the-counter sleep med for more than 2 weeks, and you should talk to your doctor before taking them to make sure they are safe for you and won't interact negatively with any other medications you're taking. Check with your doctor before trying any of the following: Benadryl or Tylenol PM. These are sedating antihistamines. Side effects could include daytime drowsiness, dry mouth, dizziness, or memory problems. Also check with your doctor before trying sleep tabs. It's another type of sedating antihistamine. Side effects are similar to Tylenol, but they can include daytime dizziness and memory problems. Finally, let's do a brief overview of melatonin. The hormone melatonin is something your body naturally produces. It helps control your natural sleep-wake cycle. Although findings are mixed, some research suggests that melatonin supplements might be helpful in treating jet lag or reducing the time it takes to fall asleep, although the effect is typically mild. The most common melatonin side effects include daytime sleepiness and headaches. Other, less common melatonin side effects might include abdominal discomfort, irritability, or confusion. Let's discuss valerian next. Supplements made from the valerian plant might reduce the amount of time it takes to fall asleep and promote better sleep overall, but the active ingredient isn't clear and potency can vary. Side effects of valerian supplements might include headache, abdominal discomfort, excitability, or heart disturbances. Moving on from medication, many people express concern about sleep apnea symptoms. Sleep apnea is a condition in which sleep is interrupted by pauses in breathing. These pauses can last from a few seconds to minutes. For most people, normal breathing then starts again, sometimes with a loud snort or choking sound. When your breathing pauses or becomes shallow, it makes you move out of deep sleep into light sleep. As a result, people living with sleep apnea often experience excessive daytime sleepiness and don't feel rested after getting a reasonable amount of sleep. Sleep apnea can be caused by either physical or neurological conditions. The most common type of sleep apnea is obstructive sleep apnea. In this physical condition, the airway collapses or becomes blocked during sleep. Most people who have sleep apnea don't know they have it because it only occurs during sleep. A family member or bed partner might be the first to notice signs of sleep apnea. Sleep apnea can be diagnosed by having a sleep study. You spend the night at a clinic and have your vital signs measured while you sleep. Common risk factors for obstructive sleep apnea include growing older, being overweight, having a large neck circumference, excessive daytime sleepiness, and smoking. Men are more likely to suffer from sleep apnea. It's really important to treat sleep apnea, as untreated sleep apnea is associated with a variety of health problems like high blood pressure, heart attack, stroke, obesity, and diabetes. Furthermore, treating sleep apnea leads to a much higher quality of life. Sleep apnea is typically treated with a CPAP machine, which forces air into your nose, preventing your airway from collapsing in your sleep. You should talk with your primary care physician if you're concerned that you have any symptoms of sleep apnea. And please feel free to ask any questions that have come up as a result from this information.